My name is Rachel Callanan. I'm a senior staff attorney at the Public Health Law Center. And the Public Health Law Center is a nonprofit organization established in 2009. We are located in St. Paul, Minnesota at the Mitchell-Hamlin School of Law. We are located on traditional Dakota lands. We're a team of attorneys and public policy experts who work on commercial tobacco control, as well as healthy eating and active living policies at the local, state, and national levels. And our organization is committed to the principle that any advances in public health cannot be achieved without achieving equity. In the context of tobacco-free schools, this means ensuring that schools have strong, comprehensive commercial tobacco control policies in place, while at the same time giving youth the support they need to grow up without the harmful addiction of nicotine and tobacco products. This means implementing measures that educate and support youth in recovery if they have begun to use tobacco products, instead of seeking purely punitive disciplinary measures that may not assist with recovery. So a quick background about what we do. We provide free legal technical assistance to public health advocates and professionals around the US in several ways, through legal research, policy development, and a wealth of publications and resources, which are all available on our website. We do presentations and trainings like this one. What we do not do, we don't represent clients directly, and we do not lobby. So with that background, let me introduce our webinar panelists today. We have Laura Alvin. She's the Tobacco Control Manager for the Minnesota Department of Health. She leads the MDH Tobacco Prevention and Control Program and directs state and local level policy change strategy, grant making, cessation promotion, health systems integration, and health equity work. We also have us joining remotely, Kathy Nickleby. She has been the principal of Matamidi High School since 2009. And prior to accepting the principalship, Kathy served as assistant principal, engineering director, and science teacher at Matamidi High School. Kathy is a past president of the Minnesota Association of Secondary School Principals and a Learning Forward Academy graduate. And Natasha Phelps is a lead attorney for the Minnesota Commercial Tobacco Control Program here at the Public Health Law Center. So today's agenda, what we'll be covering, Laura will be providing some context by framing the problem and the harms of youth commercial tobacco use and nicotine addiction. Kathy will share about the trends and challenges that Minnesota schools are facing as they navigate the e-cigarette epidemic. And Natasha Phelps will provide a detailed overview of the Public Health Law Center's Model K through 12 school policy for commercial tobacco-free learning environments. The model policy is available on our website. Finally, we will have some time for questions and answers from the attendees. Questions, again, can be submitted through the Q&A and chat box as part of the Zoom software. And we'll do our best to follow up on the questions that we don't get a chance to answer. And finally, there will be a brief survey that is sent out after the webinar. Please provide us some feedback on the webinar with that. And with that, I will hand it over to Laura Alvin.
Good afternoon. It's my pleasure today to present, and I'm especially pleased to be doing it with my good partners at the Public Health Law Center and the Minnesota Principals Association. And it reinforces that none of us can do this alone. And it's with the united front that we'll be able to tackle this growing epidemic of youth e-cigarette use. So as is true in many other states, we've seen a dramatic rise in youth e-cigarette use. And from the last time we did the youth tobacco survey, we saw a 50% increase in youth e-cigarette use. The other finding that came out of that survey was that 1/3 of the youth that reported using e-cigarettes have used their vaping device to vape recreational marijuana. And as you might imagine with vaping, this emits a limited odor and is easily hidden. So it presents a new set of concerning problems with regard to youth e-cigarette use and marijuana. So we issued several years ago the first of many health advisories related to youth e-cig use. In our original advisory, we noted that there are concerning impacts on the developing adolescent brain with noted complications for learning, memory, and attention span. The thing to know about nicotine and the developing adolescent brain is that it changes the brain chemistry in a way that makes youth very susceptible to addiction. And we know that earlier the exposure, the greater risk. This is especially concerning when we have growing reports of middle school use of e-cigarettes. So the other thing to know about nicotine addiction is that it can appear in really a very few days or weeks and happens quickly after smoking initiation. Not every youth will become addicted, but all youth are susceptible to it. It also increases the odds of later smoking 4 times to those youth that have never used e-cigarettes. So we could end up with a very concerning cycle where youth are introduced into nicotine use through vaping and end up smoking. The other risk with e-cigarette use is that it increases the long-term susceptibility to addiction, not only to tobacco, but other drugs and alcohol as well, permanently changing the brain and increasing that likelihood of addiction. So we're getting a lot of questions these days on what's in the aerosol that the youth are inhaling into their bodies and then later exhaling into the air. The CDC has created the infographic to the right of your screen and has found in the aerosol heavy metals, including tin, nickel, and lead, cancer-causing chemicals, of course, nicotine, flavoring. And the thing to note about flavoring is that many of those flavors are approved by the FDA for ingestion, but none are approved for inhalation. And of course, the ultrafine particles that can embed deeply into the lung, causing injury and damage. With the advent of Juul and the explosion in the market share, the thing to note about Juul is that it presents some of the highest levels of nicotine historically available on our market and outlawed in some other countries at those high levels. It relies on a new kind of technology that derives the nicotine from salts, and it transfers into the body more quickly and provides a kind of a different sensation that has been very attractive to youth, and of course comes in multiple flavors that attract and end up addicting youth. So we have developed a set of recommendations which are all available on our website through a toolkit. At a high level, we're asking schools to increase awareness and become knowledgeable about the different devices and the risks that they pose, implement and enforce tobacco-free policies. We'd like everybody to update their health curricula, and I'll be providing some examples shortly, and to do their best to educate parents, and as the principal with us today is doing, educating policymakers for identified action steps. In the toolkit that we have developed, and we're continually adding to it, we are offering free posters, signage, curricula, talking points, fact sheets, parent resources, model policies, and of course, quitting resources for those youth that have become addicted. We'd like to invite you to visit our website early and often. So for administrators, we're recommending, and this is the focus of the webinar today, that they strengthen and review their current policy with regard to youth vaping. Many schools have issued parent advisories warning parents and increasing awareness of the dangers of this youth vaping epidemic. promoting positive health messages and modeling in the schools, and of course, posting signage. So one of the foci of our webinar today is will be on the focus of counseling and education as a consequence for youth that are found vaping. I think the thing to note, and Natasha will emphasize, is that youth are subject to extensive, unbounded social media and marketing by large industry manufacturers, and the fact that this is a highly addictive substance and that many youth may be addicted. So we'll be highlighting today some of the many alternative consequences to suspension that that schools can offer and we think are more effective. With regard to curricula, we have posted on our website some brand new curricula developed by Stanford Medicine, including their tobacco prevention toolkit and Catch My Breath, which is an e-cigarette and Juul prevention program. And we have other resources that are easy to use and student friendly. And finally, the school health services, nurses, et cetera, in the schools, we are asking to help be part of our messaging and education effort so that students understand the harms of nicotine and e-cigarette use and serve as a source of resources. We also have developed new toolkits and resources that are specific to youth with available supportive services to help them quit. And of course, for parents, please know the risks, have direct conversations with your youth. Many of the youth do not understand the harms of vaping, what's in the aerosol, the danger of nicotine, and the consequent related harms to brains, to lungs, to addiction. And of course, please set a positive example with regard to tobacco use. Many communities across Minnesota and the nation are taking action. I'm pleased to say we already have expanded our clean indoor air law to include e-cigarettes, but many other communities, 40 to be exact, have adopted T21, or increasing the minimum sales age to 21, which is an effective strategy to get tobacco out of the schools and remove social sources for high schoolers, and limiting, restricting the sale of flavored menthol and flavored tobacco to adult-only establishments. If there's any other questions, I'd be happy to answer, and please feel free to use our website. Thank you. I'd like to turn it over to our excellent partner and attorney, Natasha Phelps.
Thanks, Laura. I think now we're having Kathy Nickleby.
Sorry.
It's okay. Kathy taking it away and talking about what's going on in Minnesota schools with that firsthand experience, which we're so excited to hear about. So thank you, Kathy.
I truly appreciate being able to be a part of this conversation as the vaping epidemic is growing and continues to grow each year. Next slide. I want to talk a little bit about the trends that we're seeing as principals, some of the barriers in our way, and suggest some solutions that might help with this. So first of all, as you've heard, tobacco use has been on the decline prior to the introduction of vaping devices. So tobacco use was going down, and now with the e-cigarettes, it's increasing. Also at the time, underage consumption of alcohol use had been on the decline. But now vaping is considered a teenage epidemic. A recent survey, a national survey, shows that 37.3% of 12th graders reported vaping, over 30% of 10th graders reported vaping, and over 17% of 8th graders are reported as vaping in the last 12 months. Next slide. Here you can see the trends for the underage consumption. And on the next slide, you'll see the increase with the tobacco and vaping devices since 2015. So some of the barriers that we are running into is the e-cigarettes and the juice are easily obtained online. They're very easily concealed and hard to detect. If you haven't had a chance to see an e-cigarette lately. They're smaller than a jump drive. They can be hidden anywhere. Of course, as mentioned, they're attractive in their flavoring. And our students and families don't understand the long-term physical effects. And it is actually socially acceptable. You know, traditional tobacco use became socially unacceptable, but now vaping is considered acceptable. It is actually condoned by some parents and peers, and the marketing campaigns are working right at our adolescents. It's ironic to me that Juul can advertise on television and radio, but tobacco was eliminated from advertising years ago. Students are also using it to self-medicate because they're not just using nicotine, there is marijuana and sometimes synthetics in the e-cigarettes that are very harmful to our kids. Next. So some of the current practices that schools across the state of Minnesota are trying to reduce the vaping is the monitoring of the restrooms and reducing the number of passes for students out of classrooms. I will tell you though that some students are so bold, excuse me, as to vape in a classroom when they think they won't be detected. Washington County and other counties have diversion programs for students. Citations are typically served by local law enforcement or if there's a school resource officer in the building. There is chemical health support, cessation resources, and we are working very hard on educating our families and our students. We're looking at opportunities for community service and restitution rather than pulling students out of a classroom and missing the class, whether it's through suspension, in-school suspension, or some other kind of disciplinary action. We always confiscate the device and substances. Parents are allowed to retrieve those devices if they request that. We always contact the parent and guardian, and we have not seen an impact of suspensions on decreasing the use of e-cigarettes. In Washington County, we work closely with the Youth Service Bureau for classroom presentations. It's targeted to support our youth, whether they're at risk or not. We work with our staff, all the employees in our schools for our education, so we know what to look for and the harm that it causes our students. We have offered support for parenting and caregiver education. We, of course, put posters in the school, and we have chemical health advisory boards. So some solutions to some alternatives to just disciplining a student, maybe suspending them, would be the diversion programs, and they would be more specific for drugs versus other diversion programs. The challenge that we have is how do we ensure attendance and participation? We can assign a student and a family to attend a diversion program, but we can't always make them attend. We continue to look at our educational resources for our juveniles and their parents. Many schools are able to have school drug counselors, education programs, really helping our families and students understand that physical impact. We really have to look at the manipulation by marketing tactics that get the juveniles addicted, the cost of addiction, and we need to empower our families and parents to act. If you have any questions, please feel free to contact myself or our executive director from the Minnesota Association of Secondary School Principals.
Okay, great. Thank you so much, Kathy. I just wanted to say that this is a really exciting opportunity to have all different partners and folks from different walks of professionalism to come together to address this issue. Like Rachel introduced me before, my name is Natasha. I am an attorney at the Public Health Law Center. I lead our Minnesota commercial tobacco group. And so I won't go over what we do, but what I do want to note here is it's important for you to understand that we're actually funded by the Minnesota Department of Health to provide free legal technical assistance to communities across the state of Minnesota. So what that means for you is that if you have any questions following this webinar, if you have a request for us to review your school policy, or if you have a request for us to come to a presentation, for example, please let me know, please let Rachel know, and we will be happy to follow up on that request with you. So I want to thank Laura and Kathy for going over and summarizing the problems associated with the youth e-cigarette epidemic and the health harms associated with the use of these products. E-cigarettes are essentially an unregulated product, not regulated by the FDA, which makes taking action on a local level, on a community level, even more important in order to protect youth and communities from the harms associated with commercial tobacco products and specifically e-cigarettes. The Public Health Law Center has a number of resources for schools and communities to address youth use of commercial tobacco products. And these documents, I just want you to know, they're not just for lawyers, they're not just for public health officials, they're for teachers, they're for student counselors, drug counselors. They provide information, statistics on commercial tobacco products and use and health harms associated with that. And then they also provide rationale for public health policy and how public health policy is effective in light of human behavior and the systems that are set in place in our society. But today I'm going to be summarizing a publication that was just re-released of ours, funded by the Minnesota Department of Health. We have developed our model commercial tobacco-free policy for for K through 12 schools in Minnesota. You'll see both of those resources on your screen. On the left, both publications, I should say, reflect the same model policy. So both publications contain the model policy for K through 12 schools to effectively create a school environment free of commercial tobacco products. The resource on your left is the model policy plus shadow boxes, which contain questions and answers and comments on reasoning behind the policy. And then the resource on the right is just the policy without the Q&A or comments component. So, you know, before I summarize these model policies, or this model policy, I should say, which is what we're here to do today, I do want to note that there are federal and state laws that prohibit the use of commercial tobacco products in some inside areas of schools. And I wanted to note that our model policy goes above and beyond any state and federal prohibitions on the use of commercial tobacco products in school environments. So first, I just wanted to provide a summary of the effect of the policy. So the policy generally provides a definition of commercial tobacco products to include current and foreseeable future products. So the tobacco industry is constantly developing new products. I think Juul is a really good example of a product that we didn't see coming and is designed in a way that's different from other e-cigarettes, but still is under the category of e-cigarettes. And so the definition that we provide is comprehensive. The policy also prohibits tobacco products and tobacco-related devices, including e-cigarettes, imitation tobacco products, and lighters. And these products are prohibited on campus, which includes inside and outside of buildings, and at off-campus but school-sponsored events. The policy also prohibits schools from accepting any donations or curricula from any tobacco-related industry and prohibits the promotion of tobacco products, including e-cigarette products, by any person on school property. And finally, as Laura mentioned, it includes effective and holistic enforcement options. I'll go into detail on all of these topics, but here is a skeleton of the model. So you'll see here all of the key components of our model K through 12 policy. Strong policies include all of these key components. And I'll briefly go over each component today, pointing out areas of interest and for your consideration. So first, we're going to start with findings section. So there's a purpose section and a findings section. And a purpose section and a findings section are important because they provide the explicit intent, reasoning, and evidentiary basis for the proposed policy. So let's first talk about the findings policy. So the findings policy contains findings needed to support the components that I'll be going over today. These findings include the statistics that Laura and Kathy went over, and I won't reiterate those, but really we're talking about use rates for use of e-cigarettes, for example, and the harms associated with the use of those products. So that's an example of finding. In addition to the findings that are in our model policy already, schools might want to include community-specific findings in their policy. So, you know, the Minnesota Department of Health releases information to local public health departments about youth use in their area, and maybe that's a way to incorporate local statistics into a school findings. And note also that if a school does use our model but makes edits to it, the findings and purpose section should be adjusted to reflect those changes as well. So for example, we don't believe that it's good practice to do this, but there's a prohibition in the model policy prohibiting advertising in the tobacco industry's self-serving anti-tobacco curricula, which I'll go over in a minute. If a school were to remove these provisions, which again, we don't suggest doing, then their findings and purpose section may then want to be adjusted as well. So the purpose section reflects the intentions and the beliefs of the school district or the school, and this section should provide clear reasoning as to why the school board or other authority decided to adopt the policy, and just generally, and then why they adopted it to the extent that they did. So it's very clear about the intention behind the policy. In case any questions come up, people can look to the policy and make a judgment call, and that judgment call will be based on very clear intention set by the school. You'll notice in our findings and purpose sections that the term commercial tobacco is used throughout. The Public Health Law Center recognizes that traditional and commercial tobacco are different in the ways that they are used, grown, and harvested and planted. So traditional tobacco is and has been used in sacred ways by indigenous communities and tribes for centuries. Comparatively, commercial tobacco is manufactured with chemical additives for recreational use and for profit, resulting in disease and death. So the language in the purpose and intent sections helps to make it clear that the school recognizes that difference. Even though the word tobacco and tobacco products, tobacco-related devices, is used throughout the model policy, using this language of commercial tobacco in the beginning in the purpose and findings section makes it clear that a commercial context is implied and intended throughout the rest of the policy. So in fact, the policy does later also exempt use of sacred tobacco in schools, which I will touch on later. So let's move on to the definition section. A thorough definition section explains the language and wording used in a policy. It helps ensure that the language is consistent throughout the document, and it helps make clear what is covered by the defined terms. So this policy, for example, defines the word staff. So readers will know that it refers to all people employed by the district, either full-time or part-time, as well as volunteer and contract workers. And this is important when you're trying to enforce a policy. The definition section also makes clear what's covered by the defined terms in relation to the products. So the policy does cover all tobacco products, including e-cigarettes, and also regular combustible products. So even though today the focus is on e-cigarettes and the vaping epidemic, traditional combustible cigarettes like menthol cigarettes are also covered. And it's important to understand that because, as Laura mentioned, when youth initiate use of e-cigarettes, they are 4 times more likely to then start using combustible products. And so it's very important for schools to be aware that the problem is not just about e-cigarettes, but it also regular combustible products as well. And a well thought out definition section can help to reduce any ambiguity and confusion. For example, clarifying the meaning of tobacco products helps those responsible for enforcing the policy to know what products are included. And so there was a study that was done by the Truth Initiative some time ago about recognition of a Juul device by school staff and administration. And just 40% of middle and high school staff correctly identified the Juul device, flavor pods, and reported that they had heard of a product called Juul. And so if they have heard of a product called Juul, it's important that the definition explicitly includes the word Juul in the definition so that people understand that that's an e-cigarette covered by the policy. Additionally, our model policy prohibits imitation tobacco products, like the one pictured here on the bottom of beef jerky that looks like smokeless chew tobacco. And imitation tobacco products normalize and encourage tobacco use and can pose enforcement challenges. So having a definition of these products will help teachers and other enforcers of the policy understand what's covered and then understand the reasoning why. Let's move on to the major policy provisions. So this is kind of the meat and potatoes of the policy. So basically what the policy does is it prohibits students from possessing, using, displaying, consuming, or selling all tobacco products. Again, that includes e-cigarettes, and it's important that the model policy is clear on that. At any time and on school property or at any off-campus school-sponsored event. So being very clear about the what, the where, and the when will be key for ensuring that your policy is actually effective. It also prohibits staff, administrators, and visitors from using, consuming, displaying, activating, promoting, or selling all products at any time, and again, on school property or at any off-campus school-sponsored event. Additional policy provisions are listed here, most notably prohibiting schools from accepting donations or other money and curricula from the tobacco industry. Another provision prohibits any person from promoting tobacco products, including promotions on signs, clothing, and other gear. And so there are many things, many other miscellaneous policy provisions that are included in the policy, and we're happy to talk about that. But I wanted to make sure that we went over why including prohibitions on accepting money and curricula from the industry and the promotion of industry-related products is important. So R.J. Reynolds reported that by 1999, and R.J. Reynolds is a major cigarette manufacturer, tobacco industry giant, that it had distributed materials to millions of young Americans through youth-oriented establishments like amusement parks, video arcades, theaters, sports, boys and girls clubs, and schools. And this included what they refer to as youth smoking prevention programs, which were actually found to minimize the health effects of commercial tobacco use and subtly promote smoking. So even though it was supposed to be an anti-tobacco campaign, it actually minimized the effects to youth who were viewing the advertisements and enticed them to use the products. In 2000, Philip Morris distributed a book cover, which you see on the left on the screen here, called Think, Don't Smoke, to California schools without prior authorization. There was a huge effort across the entire state, led by the California Department of Education and Justice, to pull the covers. And the Department of Education and Justice actually warned schools that the industry was attempting to promote its corporate identity to children. Just for example, you can see that the snowboard on the left actually looks like a match. So there's a lot of subliminal advertising in these anti-smoking campaigns. Similarly, a recent hearing before US Congress on the tactics of Juul Labs revealed that Juul has mirrored and intentionally copied the behavior of its tobacco industry predecessors like R.J. Reynolds in the late 90s and early 2000s. So in the congressional hearing, there were student testifiers who talked about Juul's attempt to roll out, again, an anti-tobacco curriculum in schools last year. And perhaps some of you joining the webinar received that curricula or at least had information on that. So on the photo on the right is a photo of students who testified before the US Congress on this anti-tobacco education program when Juul came into their schools to talk about anti-tobacco. The students testified that they were left alone with the Juul representative in the classroom and that the teacher was asked to leave so that they could speak freely without concerns of the teacher's discipline about nicotine and tobacco use. Once they were left alone with the Juul representatives, the students testified that they were shown Juul products and told that they were not harmful for their health. They testified that the language was suggestive to actually use Juul. The link for that video is below on this webinar page. I would highly encourage everybody to watch the video. It's very moving and informative and quite scary. So Juul has offered school districts thousands of dollars as well to implement new technologies in order to implement the curricula as well, which raises significant data and privacy issues for schools. So the new technologies offered by the tobacco industry and other industries and tobacco products themselves are a huge concern to data mining and privacy issues for students. For example, Juul Labs is experimenting with facial recognition and geofencing technology. The geofencing technology, for example, would allegedly shut down devices in spaces where Juul is prohibited, like schools, for example, if that technology was allowed into schools. But this would also provide the company with a significant amount of GPS location data for users. So Juul has a C1 device that also collects the user's phone number, date of birth, national identification number, and information related to their vaping habit. So again, a huge amount of information for a company to collect on youth users who are unaware of these privacy issues. Other companies, often associated with the tobacco industry, offer multi-sensor devices that are claimed to be capable of detecting vaping, smoke, and other noise disturbances that are allegedly suggest violence like bullying, where other kinds of monitoring is not allowed, like bathroom stalls. So allowing these industries into schools could seriously threaten the privacy of students and spread misinformation and interest in these harmful products. So let's talk about the exceptions, moving on, the exceptions to the policy. So the Minnesota Clean Indoor Air Act prohibits the use of tobacco products, like I stated earlier, in many public spaces, including schools. But there is an exception for the sacred use of tobacco for a recognized religious practice, including indigenous ceremonial tobacco use. So our model policy exempts the same. The use of tobacco products and devices as a part of an indigenous practice is exempted from the model policy. Especially, for example, if you're going to have somebody come in to do education on that type of tradition. Also exempted are possession of tobacco products if included in an instructional or work-related activity, so long as it's not smoked, chewed, or otherwise ingested. So we wanted to include this exemption as an opportunity for schools to allow local public health or perhaps the state health department officials to come in to do education for students, staff, administration, parents, or guardians. Another exemption that's located in the model policy are any FDA-approved cessation devices for non-students ages 18 and over. I wanted to note and make very clear that e-cigarettes are not an approved cessation product, despite the assertions of the tobacco industry. And so when we're talking about exemptions for FDA-approved cessation products, we're talking about the patch or Nicoderm and other FDA-approved medicines. When we are talking about cessation products for underage persons, Laura hit on a lot of resources that are available for youth and located in the MDH toolkit, but that does not, again, include any tobacco products. And actually, there's another key component of the model is the provision that encourages schools to work with local public health departments and community-based organizations in order to ensure that the school is connected to the latest and greatest on cessation support. And this is especially important when we consider the enforcement of this policy. So you'll see in the model that punitive measures like suspension and expulsion are not included. Enforcement of the policy for students who violate the policy is graduated based on the number of violations incurred by the students. All penalties include confiscation of the products, notification of parents and or guardians, and additional measures geared toward education and cessation support. Like Laura mentioned in her slides, the CDC recommends counseling and education as a response to youth tobacco use. The publication pictured here actually explains our model enforcement language for students. We decided that it was important to have a supplemental memo explaining the harms associated with punitive measures for addicted youth and their violations of laws and policies associated with commercial tobacco. This memo provides a deeper dive into why alternative measures included in the policy may be more effective than suspension and expulsion at addressing student tobacco use and nicotine addiction. And just the key takeaways for you to know today is, as Laura mentioned, the tobacco industry has historically and continues to target youth to maintain profits, especially in and around schools. Schools should consider these predatory tactics when creating or modifying a school policy to address youth possession and use of commercial tobacco products in school. So one may say that the students themselves are victims of the tobacco industry's malicious targeting. Nicotine exposure in adolescence can permanently change brain development. And so this makes addiction to nicotine extremely difficult to break. So when kids are using in schools, they are likely feeding their addiction caused by predatory injury. So using punitive measures like suspension and expulsion to penalize student violations of a school commercial tobacco policy is not necessarily reasonable, considering the targeted marketing, science of addiction, and long-term consequences associated with expulsion and suspension, which not only harms the student that could be suspended and expelled, but also the general population of the school. Disproportional discipline in Minnesota and around the country is a very real issue and a major concern for both significant and minor infractions. And so when we're talking about discipline and commercial tobacco policies, we want to acknowledge that violations of a commercial tobacco policy plays a role in that as well. So on the right, I have a picture of the Rochester Public School District, who has been dealing with this for quite some time, and due to their efforts have recently seen a decrease in disproportional discipline of students of color. And one of the leading causes of out-of-school suspensions include drug and tobacco-related offenses. And these disciplinary measures, as stated in our publication, can have significantly devastating effects on the students facing those penalties and the student population overall. The Rochester Public Schools Superintendent has noted that there's significant work to do on the issue, and I think that this is something that all schools should be thinking about. So what we're hoping to avoid with the tobacco-free model is to not include the industry's successful targeting of children to result in more children going into the school to prison pipeline or other detrimental life outcomes. Enforcement for staff is a bit different for students. We strongly encourage schools to consider existing policies and procedures for staff violations of school policies, as well as any collective bargaining agreements if you make changes to this provision. But we do have some model language in our model policy for your consideration on that. Enforcement for visitors is also included in our model policy. Essentially, it's again an escalation. If they do not comply with being asked to stop the violation, it works its way up the chain into potentially asking the individual to leave the property, all the way to prohibiting them from entering school property for a specified period of time. So the decimation of the policy is really key in order to ensure compliance. If you don't tell people that a policy exists, it's unlikely that they actually will abide by it. So decimation can be seen in many different ways. Number one is signage. And there are many resources for schools to find signage. They don't have to do that on their own. As Laura mentioned, MDH has a plethora of resources for schools in talking about commercial tobacco-free policies and signage and communication with parents, et cetera. But other suggestions include, putting an ad in the local paper, thanking the school board for its decision to make the school 100% free of commercial tobacco. If the decision was for a private or a charter entity, consider, also thanking the governing body. You might also consider asking community agencies like local public health departments and tobacco-free coalitions, parent-teacher associations, asthma coalitions, et cetera, to include an article about the new tobacco-free policy in their newsletters. And then again, include written reminders of the policy in event programs, handbooks, and other school announcements. Finally, the policy also includes a requirement that schools assess whether their policy is actually working. This is not something that we want to see schools put into place and then it doesn't get revisited or changed if it's not working. And so the provision does require schools to assess whether the policy is working at least once per year. and to determine whether the policies, the policy enforcement, communication, education, staff training, and cessation programs are effective. Again, working with non-traditional partners like local public health departments, parent-teacher associations, to have these conversations and be involved in the assessment would be helpful. And policies and programs are then required to be updated and revised accordingly. Again, this is an opportunity for schools to work with non-traditional partners and the policy in general. After this webinar, if you're interested in revisiting your policy, just a really good opportunity to connect with local public health if you haven't already. So like any policy, you need an effective date that indicates when the policy will go into effect. And this is important because the date should allow for preparation, education, and then set clear expectations. So, don't hide this from students. Let students know about the changes to a commercial tobacco-free policy that the school has made. Let them know when it will go into effect. Talk about all of the resources, the cessation support that will be available to them. So it doesn't just have to be reactive. You can proactively work with students so that there aren't violations on the back end. And lastly, Laura mentioned the fact that communities around the state are working on policies to get tobacco, to limit youth access to tobacco and also to limit the interest in tobacco products. And this type of policy change is happening around the entire country. Local and state policy can limit youth access and interest in commercial tobacco. And here are a couple of ways in which that can be done. Number one, as Laura mentioned, communities can restrict or completely prohibit the sale of flavored tobacco products, especially menthol cigarettes. So I talked earlier about e-cigarettes and the likelihood of using combustible products after starting use of e-cigarettes. Menthol cigarettes are youth who actually start smoking combustible products are way more likely to start using cigarettes that have the menthol flavor. And so it's really important that that would be included in any work that communities do on flavored tobacco sales. Also, as Laura mentioned, 40 communities in the state have increased the minimum legal sales age to 21. And I just wanted to note there again that there's an opportunity to ensure that there are no penalties against underage purchasers, users, and possessors in those local laws that increase the minimum legal sales age. Increasing the price of products is really a good deterrent for price-sensitive populations like youth. And so that's another option for communities. And then limiting or restricting the location, number, and density of commercial tobacco retailers when evidence is very clear that the tobacco industry knows that the more they are located near schools or other youth-oriented facilities, the more likely they are to hook children and start an addiction that will feed their pockets for life. It's very important to address the density of those retailers and their location and proximity to your youth-oriented facilities. And then finally, ensuring that there are comprehensive smoke-free policies and laws. We've had some great movement at the state this past legislative session, but local communities can always do more, including prohibiting the use of commercial tobacco products outdoors. Schools can be involved in community-led local and state policy change. And I just really want to be clear that with the T21 movement and the flavored tobacco movement, we have seen schools get involved, and it's very important for them to have a voice in that community change because they're the ones seeing it. As Kathy mentioned, dealing with this issue and being overwhelmed by the problem is something that lawmakers should hear about and have youth involved as well and students involved as well. It's very effective. And so schools can also become involved. And one way to do that is to connect with your local public health department. The Minnesota Department of Health funds local public health departments through their statewide health improvement program to work on strategies that address commercial tobacco use. You can also connect with organizations like the American Lung Association of Minnesota and Answer Minnesota. We have a ton of resources on our website that I just think a lot of you would really enjoy. One publication that you might really get a lot of use out of is a recent publication that came out last summer, which is Juul and the Guinea Pig Generation. There are legal pieces in it, but it's really an overview of Juul, how they came to be, what the products are like. It's really, really useful, and it's been a very popular publication on our website. There's also a webinar associated with that publication. We also have our tried and true publication that people really just love over time is The Verdict is In, and that is a summary of litigation that came out in the 2000s by a judge who summarized all of the tobacco industry's tactics, marketing to youth. So you'll see on the right, there are white bullet points for the sections of the judge's findings, and the one that's bolded right there is marketing to youth. You can go to that specific section and actually find quotations from tobacco industry documents about how they have targeted youth. So you can come to understand how when we're talking about youth addiction, we're not talking just about voluntary behavior necessarily. If you have any questions after this conversation or this webinar, you can email me directly and I will put you in contact with any of our talented attorneys working on the Minnesota team, including Rachel. And we are just happy to help with anything that you need: questions, presentations, publications, sample language, a review of your policy, and more. And we also have a newsletter that you might want to sign up for, which again, please just email me and I'll make sure that you're signed up.
Great. Well, thank you so much, Kathy, Laura, and Natasha for this amazing information. We have about 10 minutes for some questions and answers, so we're going to get to that. We did have a few that came in advance of the webinar, so I'm going to kick us off with a couple of those, and then we'll get to some of your questions that are coming in right now through the question answer function on the Zoom software. So our first question is, what if youth are consuming cannabis or THC in the electronic devices? And I'm going to kick this one to you, Laura, because I know that has been a question that's come up in the context with some of your grantees.
Well, yes, this is very concerning, and it's not only in our bailiwick. Obviously, marijuana is a controlled substance and is illegal. Part of the conundrum with youth vaping marijuana is that it is odorless or almost odorless, so it's much harder to detect. To me, it reinforces the importance of using the tools in tobacco that we do have, like increasing the minimum sales age for purchase of those devices to 21. So that with the tobacco control tools, hopefully we can combat the illegal activity of marijuana use among youth.
Great. And Natasha, do you have anything to add on that subject?
Yeah, I just think that's such a perfect answer. I just also wanted to mention, when it comes to use of e-cigarette devices and THC and other marijuana-derived liquids, it's something to note again that these products, e-cigarettes, are unregulated by the FDA. And so all the time, no matter whether it's Juul or any other product, kids are not certain as to what it is that they are consuming. And so oftentimes there will be e-cigarette products that have been opened, even if they weren't intended to be opened, or maybe they are open devices where people have created a concoction of nicotine. Perhaps there's some THC mixed in there, but it's really, I think, important, in addition to Laura's point, to note that sometimes kids do not know what's in these products. But we, again, would refer schools to our penalties for use and possession, again, to focus on counseling and education, and then to refer to any state laws that are already put in place for illicit drug use. Obviously have power over schools and any student liaison officers that are there, but there's discretion and enforcement as well. And so again, when we're talking about addiction, schools should consider what actually is effective for their student population, and we would say that our alternative penalties would be what is most effective.
Great, thank you. So another question that we had in advance was, how can the electronic devices, cartridges, and e-liquids be disposed of safely? And this is a growing concern as I think Principal Nickleby mentioned confiscating the products. What's the appropriate way of handling them? Natasha, do you have some thoughts?
Yeah, so this is, I mean, there's so many layers to this question, right? So first of all, I just want to mention again that nicotine solutions, whether it's e-liquids, e-juice, whatever, can be absorbed through the skin. And so it is an employee hazard to handle these products. And so if teachers are confiscating products in the classroom, handling them with their hands, and it's leaking into their hands, they could suffer from nicotine poisoning. And I personally am super susceptible to that. I've definitely touched an e-cigarette or even smelled an e-cigarette and gotten very sick. And so anyways, it is an employee work comp hazard, something to definitely consider for schools. But I think this is an opportunity for schools to work with non-traditional partners like waste management and public health and safety as to what the best options are for confiscating products. You know, whether that's having a reciprocal in every classroom for teachers to also provide them with gloves in order to put the products in these reciprocals, and then have a relationship set up with public safety or law enforcement or waste management to come pick those products up and dispose of them safely. We are just interested to see how this develops. And Kathy, I don't know if you've heard of how schools are disposing of these products, or Rachel, if you have anything to add.
Yeah, Kathy, do you have more to add?
Sure. What I would say is that this really reinforces for me the need for a model policy so that schools have clear direction as to what they can do with the devices, whether they, how they dispose of them. Typically, a school will hand them over to a local law enforcement agency where they will be disposed of, but you're absolutely right. If you're not wearing gloves, it can easily be absorbed through the skin. I believe there was another question here about why would we give them back to the parents. Different schools have different practices, and for us to be able to have clear guidelines as to work with a model policy would be very helpful.
And we can certainly work with individual schools on how they feel confiscation and disposal of these products would best work for them. Yeah. In a way that is clear and with defined terms and safe for all of those involved.
Right.
Great, thank you, Kathy and Natasha. So we have a few questions that have come in. One question about the statistics across Minnesota, and Laura, would you handle that?
Yeah, so youth tobacco use is something that we track very closely, and we have two tools that we use. Every 3 years, we do the youth tobacco survey, and the data that 19% of the youth report 30-day use is from that. Every other year, we also do the student survey. So the YTS is a sample. The student survey is a more comprehensive approach across all of Minnesota, and all of that data is available under the data report section on our website. There was another question about where to find the curricula on our website. If you go to the e-cigarette page and then go to the school toolkit, scroll down and you'll see different sections, whether it be for administrators, school nurses, or teachers, and the curricula examples and direct links can be found there. If you still have trouble finding it, please contact me at MDH. I'll be happy to help.
Great. I have one more question for you, Kathy. What are schools doing to monitor or detect use of electronic cigarettes and other tobacco products?
At Matamita High School, we have just increased our visibility and, always keeping in mind a student's right to privacy, but we have really looked at how do we increase the monitoring. I have heard of other schools that have purchased devices that detect the vapor. I'm not sure how effective they are. That's pretty much what we're limited to that I'm aware of at this point.
And I think, Kathy, that brings up a really good point, this balance of needing to address the problem right now. But I think the good thing about the model policy is I do believe that the effective solution of focusing on cessation and education, hopefully in the long term, we'll address the problem and we'll see it go down. And then again, involvement in community work to stop the products from coming into the schools in the first place. So even though the holistic solutions aren't a response for right now, it's down the line, hopefully we're going to see a curve in the issue that we're experiencing in schools. So I think that's a really good point to balance those things.
Yep.
Great. This has been an amazing conversation. Thanks again to all of our panelists for participating and all of you participating today. Just a quick reminder that the website, the webinar and slides will be available on the Public Health Law Center website. It will be archived. And
can I mention, Rachel,
yep.
the YouTube video for the congressional hearing? I just saw a question about that. The link is on the slide that has the photo of that, so you can click the link there.
Great. But thank you all for participating and have a really great day. Thanks.
Thanks, Rachel.
Thank you.